Hi, myself Dr. Vivek Sasindran and welcome to yet another episode of ENT Talks. So in today's video, I would be showing you a very commonly used material in ear surgery. So if you have gone through my previous videos, I have done an episode on a condition called as mid-ear effusion, which is otherwise called as secretory otitis media or serous otitis media with effusion or blue ear. So this particular condition is known by so many names. The most common presenting complaint is hearing loss. So what exactly happens in this condition? There is collection of a fluid or a glue-like material behind the eardrum in the mid-ear space. Now most of the times this can happen in pediatric age group as well as in the adults. Now most of these patients are managed medically. However, there is a small subset of patients who don't do well with medications and continue to have persisting conductive hearing loss. So in that subset of patients, we opt for a procedure called as Myringotomy with Grommet Insertion. So Grommet or ventilation tube is what I would be showing you today. And when I say Myringotomy, it's nothing. It's just a term for making a small opening in the tympanic membrane to drain out the fluid in the mid-ear. However, you need that opening to stay patent and you need adequate time for the mid-ear to get ventilated. So we place this particular material. Now what is this made of? There are a lot of options. You can have ventilation tubes which are made of titanium. You can have PTFE, that is another material which is inert. So that is what we commonly use. But there are indications for using a titanium ventilation tube as well. So generally these tubes tend to fall out on its own within a period of 6 months. Now you have long-term tubes which can last up to 9 months. So depending on the situation scenario, we kind of select the tubes. Now frequently asked questions are, once this tube is in place, is it visible externally? No. This can only be seen once you have a close-up view of the tympanic membrane, that is with the help of an instrument that helps to examine the ear. Now, can water enter inside the ear? Yes. If water enter inside, can water enter in the ear when the ventilation tube is in place? The answer would be no, because if water enters, then obviously you can have an infection. Now, what are the other things that you have to take care of? Avoid introducing anything inside the ear. Avoid cleaning the ear. Now, can it get infected? Yes. If it gets infected, it can be treated medically. So most of these tubes fall out on their own and rarely require additional surgical procedure to remove. Now what you should know is that these tubes are so tiny. So these come in this sterile packing. So I'm just opening up a pack to show you the tube. And these tubes are so tiny and they have 2 flanges on the sides. So the whole idea is these are something like a dumbbell shape. So the important thing is when you place the tube between the incision that you have made in the tympanic membrane, the tube should not fall into the mid-ear, neither should it fall out. So it has to be held tightly in position. So there are flanges which help to retain its position. And if you're interested in watching a surgical video, we have it on our YouTube channel. So you could probably see it. Thank you.